Hey everyone, Justin White here, founder and CEO of Senior Health Services. Thanks for watching. Welcome to Medicare Monday. So what in the world is going on with the Part D drug plans? Some of you are going, what are you talking about? Others of you are going, yeah, what in the world is going on? Because now everybody's starting to fill their medications, and if you are somebody that is on a brand name medicine, in other words, one of the more expensive ones, you may start getting a letter or notifications that they're not filling it right away, that they want more information. Some people are getting letters that look like the medicines are actually being declined. And while it's possible that they could be declined for whatever reason, usually medical necessity, it's probably not so much that as it is that they are utilizing their techniques to make sure that that medicine, because it's expensive, is medically necessary. And they, is there anything else they can do? Can they do step therapy? Are there some generics that you can try? Is the pre-authorization, did the doctor make a good enough case for that medicine being prescribed? That's what they're doing, okay? Now, when that happens and you get that letter, you need to let your doctor know immediately, because the onus now is on the doctor to send through the justification for why that medicine is necessary. As long as it's medically necessary and they go through the rigmarole of whatever it is that they're doing in there, that medicine should probably ultimately be approved and you can go down the road. If there's any question about it, you might have to have the doctor appeal it more than once. I've seen that have to happen as well. And they're doing this because of the cost of those medicines are high, number one, but the Inflation Reduction Act that was signed in 22 had some regulations go into place in January, whereby Medicare came in like Christmas time and passed all this stuff improving, they're bragging about this, improving Part D, but what they did is they cut funding radically from the government at the same time. So Medicare used to, right when it gets expensive in the catastrophic phase, the place where your cost goes to zero, that's where this drug plan gets expensive, because once the out-of-pocket or the way they factor it hits $2,000, you pay nothing and everything is covered by whoever's there. Well, it used to be 80% this last year by the government, and then the carriers had to cover 20. Starting in January, Medicare said, yeah, we're not covering 80% anymore. We're only covering 20 on those brand name meds. The pharmaceutical companies are bringing in a 20% discount or coupon or whatever you want to call it. And then the carriers, in other words, your Part D plan, are responsible for the balance, or 60%. That is a tripling overnight of their liability on those expensive brand name medications. You wouldn't want to pay for that either. And so while I'm not defending the carriers, I'm just letting you know what it is that they're doing. So the effect of the decline, or asking for the further documentation of the necessity of that, is going to be that some people are going to go, oh, well, it was declined. Okay, well, forget it. I'm not even going to worry with it. And then they'll go and naturally kind of drift off and try to find something else that will be approved. They love that. That's what they want you to do. But at the least, it buys them a little bit of time while they're waiting on the appeal from the doctor to go through. So my advice to you is keep and stay in very close contact with the doctor who prescribed that medicine, and let them know they're not filling the medicine, so that the doctor, who by the way is not going to want to do that, but so that the doctor knows and can tell the nurse or whoever they have filing these things can file an appeal with the plan, further justifying why that medicine is medically necessary. Those are the key terms. And as long as they do a good job and get that justified, you should finally see that approval come through, okay? It's obviously ultimately up to them and Medicare, but you may have to appeal it more than once, and hopefully it turns out well for you. But if you start getting those things, that's what's going on. Thank you so much for watching. We'll see you next week, and have a great week. Bye.